Good morning, everyone. Now we are going to discuss the continuation of localized administration of drug, which is also known as topical administration. The next one is rectal. Certain irritant and unpleasant drugs which put into the rectum in the means of or in the form of suppositories. This route is used when a patient having recurrent vomiting or the patient is in the state of unconscious. The main advantages of this rectal route is it also bypasses the liver. The disadvantages is some drugs may lead to inflammations. So the rectal route is certain irritant or unpleasant drugs which is administered into the rectum by means of suppositories. This route is used when a patient is having recurrent vomiting or the patient who feels unconscious state. The main advantages of this route is it also bypasses the liver. The main disadvantages of this route, it may lead to inflammation when use of certain irritant drugs. For an example, indomethacin, paracetamol and ergotamine. The next one is cutaneous route. Highly lipid soluble drugs which is applied on the skin for sustained and prolonged release of drug. So certain lipid soluble drugs which is applied in the skin for the sustained and prolonged release. The main advantages of this route is it also bypasses the liver. In this route, the drug which is incorporated in the ointment and applied on the specific areas of skin, the absorption takes place once the drug can be enhanced by rubbing the preparation on the skin by using an oil based substances. So in this route, the drug is incorporated in the form of an ointment and applied on the specific area of skin. Absorption is enhanced by rubbing the preparation on the skin by using along with oil based substances. The next one is inhalation. Certain volatile liquids or gases are given by the route for systemic action. When the administration is withdrawn, the drug gets diffused back and rapidly eliminated through the expired air. Certain irritant vapors can also lead to inflammations in the respiratory tract and which increases the secretion. So inhalation route means certain volatile liquids or gases are given by the inhalation for their systemic action. When the administration is withdrawn or discontinued, the drug also diffuses back and it gets rapidly eliminated by means of expiration. Certain irritant vapors can cause inflammation in the respiratory tract, which also increases the nasal secretions. And the last one is rectal route. The first is rectal, second is cutaneous, third is inhalation, and the last is nasal route. Nasal route means the mucosal membrane of the nose can readily absorb many of the drugs and the digestive juices. The mucous membrane of the nose can readily absorb the drugs and the digestive juices. The main advantages of this nasal route is liver is bypassed. Only certain drugs like NGNRH agonist and desmopressin, which is used as a spray in the form or nebulized solution through the nasal route. So nasal route means the mucous membrane of the nose can readily absorb many of the drugs and the digestive juices. The main advantages of this route is liver gets bypassed. Certain drugs like GnRH agonist and vasopressins are used in the form of spray or nebulized solution through the nasal route. So these are the methods of methods which come under the topical administration. The first one is oral administration, and the second one is sublingual, and the third one is rectal route, fourth one is cutaneous route, fifth one is inhalation route, and the sixth one is nasal route. Thank you.